Hi, I'm Jackie, and I am here to present proper handling and usage of Mitomycin C. Mitomycin C is an antibiotic and anti-neoplastic agent traditionally used in medicine for chemotherapy. It is used in ophthalmology, off-label, for pterygium, and for glaucoma filtration surgery. It was first used in Japan in the late 60s, so it's been in use for a very long time. Pterygium is a raised fleshy growth of tissue from the conjunctiva, and it starts to grow towards the visual field and diminishes the patient's ability to see. So at that point is when it needs to be treated. It's removed, and at the base layer, under the lesion, mitomycin is applied to inhibit the regrowth of cells. Therefore, it keeps us from having to remove it repeatedly, because they do tend to come back unless they're treated properly with mitomycin. For storage, mitomycin for our facility comes from two different compounding pharmacies. One is local, and it arrives here frozen. We do not have a drug freezer, so it's actually kept in our drug refrigerator. So the date on the vials from Safeway Compounding Pharmacy, the date on the syringes actually reflect the refrigerated date. Fagron Sterile Services, which is out in the Midwest, Kansas, I think, our syringes arrive refrigerated, and we store them appropriately. They are now kept in a yellow bin in the refrigerator that is located in the block room. It is not in the core any longer. It's actually been moved, and it's being housed in a yellow bin, as it should be. Any chemotherapeutic items should be kept in yellow, which includes disposal. So all your sharps are going to go into a hard yellow biohazardous container. That includes any syringes, caps, anything like that would go into this container, and it's kept in the room until it's 2/3 full. And all of your soft goods that come in contact with the mitomycin will go into a yellow bag. And at the end of the day, all your drapes, all your sterile cup that has had the mitomycin in it, any sponges, pledgets, anything like that, gowns and gloves, all go in here, and it goes down to the loading dock. There's also a special box on the loading dock for this type of hazardous waste, and it has to be placed in there and taped up so that it's disposed of and incinerated properly. So when the circulator handles mitomycin, it's very important. Draw back on the syringe just a little bit. That way when you distill it into the cup, it doesn't splash. Sometimes the stoppers tend to stick a little bit. And in this process, you should be wearing a gown, gloves, 2 pairs of gloves, eye protection, and a mask. A usual PPE. For the scrub person, proper handling is the usual gown and glove fashion with eyes protected, but 2 sets of gloves. So after mitomycin is handled on the back mayo, everything mitomycin is kept separate from the main field. That top layer of gloves should be removed and placed into the yellow bag with the rest of the biohazardous waste. For disposal, we've already gone over that. Documentation, very important, because we need to track any mitomycin that's used in this facility. So we need the drug itself, the name, the strength, lot number, and expiration date should go on the chart, and there is a section on the chart for compounded drugs. In case of exposure, this is really important. If it gets in your eyes, you need to go to the eye wash station. Several minutes, many minutes of eye irrigation, and then seek medical attention, regardless of how you feel. Even if you feel better after being exposed, you have to see an eye doctor to have your eyes checked. If it touches your skin, you're to wash your hands with soap and water twice, and as long as your skin is intact, that's adequate. If it hits broken skin, then you need to, again, wash with soap and water twice and seek medical attention to make sure that the wound is checked for any kind of signs of damage to the area. For spills, the spill kit for this product is kept in OR1 because that's where most of our ophthalmology cases are done. And if it's less than 5 mLs, state regulations say that it can be cleaned up by a staff member. It is not a hazmat situation. So you will open this spill kit. The spill itself will be soaked up with towels, and that will go into the bag provided in the spill kit. And you're to clean the area with detergent twice, scrub it. All those things go into the bag, and then you rinse it with water. And all those things, along with your gloves and any PPE, go into the bag after the spill, and that should be adequate. My sources of information for this presentation are our material safety data sheet, which can be found on the J Drive. And also I did some research online, which is a really good article, American Society of Ophthalmic Registered Nurses. So it's a section of the AORN. So it was a really good article, and if you wanted to ever follow up, you can always read the article. I have it in my office. Thank you.